Hey, so this video today is for my athletes that do a lot of lunging type activity in their sport. And perhaps you are starting, or maybe you have been having pain on the side of your hip that now is going down the side of your leg down towards your knee. And perhaps you thought, okay, this kind of sounds like it could be my ITB. You've been foam rolling it, you've been stretching it, and maybe it helps temporarily, or it doesn't really help at all. And it's this nagging pain every single time you do a lunge. And then maybe after you play your sport, it's like bothersome to you. So if that is what you're going through, then this is the video for you, because we're going to talk about what it could be, what could help, and how we might be able to help, especially if you live around this area. Now, who am I? I'm Hina Sheth. I am an orthopedic and pelvic floor therapist, and our clinic, Rebalance Physical Therapy, in Philadelphia, Pennsylvania, and here on the main line in Narberth, Pennsylvania, specializes in treating chronic orthopedic conditions, especially those around the hip, the pelvis, the back. That maybe you've tried traditional treatment and it hasn't really worked. So we really take a holistic approach on really finding out the cause of what's going on and kind of getting to the heart of why this is still troublesome for you. So let's go back to this stubborn hip pain. Now, for many of you, especially if you're in a sport, for example, squash. I play a lot of squash, my kids play a lot of squash, and this video was actually, the idea came about because one of the squash coaches actually asked me about their own problem around this hip. And what we're noticing is there's actually a lot of people who end up having this problem. Now, usually the ITB is something that a lot of people think of. They think, hey, it's probably tight. It could be one of the reasons why. But what we typically see actually is it's not always the ITB that is the culprit of this problem. Usually what ends up happening is it's actually one of these muscles in the back. Now let me orient you real quick. This is the rib cage, back of the spine, lower part of the spine called the sacrum, your tailbone, and these are your hip bones. Now you can see here, there is a ton of muscles, especially these rotators and these glutes that are deeper underneath the gluteus maximus muscle that actually are responsible for stability and function around that hip. And if these muscles are not working properly, then they'll actually end up getting strained, and they develop knots and spasms in there that can actually end up causing a similar pain to what you are feeling. Now, what are these spasms and knots that end up happening there? Well, when a muscle is overworked or it's compensating for some reason because of other imbalances, and we'll talk about that in a minute, then these muscles become overworked. They can't do the function as long because of endurance, depending on how much you're playing the sport, or it just can't allow this hip to function normally because there maybe initially was a lack of strength, but then it got overworked, it compensated with other muscles, and now it spasms up on itself and it basically says, I'm out, I'm done. And when you start getting spasms, you not only start having pain localized in that muscle, but it can also travel and refer to other areas. And so what we often see is that people will end up experiencing pain that looks like this. And you can see this looks similar to the ITB because it's kind of going down the side of the leg and maybe in the buttock. Now you might be looking at this and you're like, oh my God, that is my pain. But guess what? This is actually not the ITB that is creating all of this referred pain. It's actually spasms within, in this particular picture, the gluteal muscles. But you can have something very similar because there's lots of muscles that attach to the hip. These are just a few of them, but there's lots of other muscles that attach to the hip that might have a similar pattern to what's going on here. So if these muscles, for instance, these are your gluteus medius muscles, if these muscles are basically getting irritated and spasmed, then it'll create this type of pain, but so will other muscles as well. So if we look at the other muscles around the hip and the pelvis, we'll see here that you can see here, this is the front of the body, the abdomen, this is the pelvis, there's the hip. You can't actually see the hip bone, but it's basically in through here. There are a lot of muscles that attach up into the hip, through the hip and up into the pelvis. Now this is just the superficial muscles like your quads and your sartorius and your inner adductors. But if you take this off, there's actually all of these deeper muscles in through here, which are like your hip flexors. And for many people that end up coming to our clinic, it's not only these muscles that could be the problem that are either, like I said, this combination of weak or tight, but it could be also muscles that go even further up from the hip. And here's the hip again, all the way further up and through the hip, through the pelvis, all the way up into the spine. And honestly, I know it sounds strange, but even into the diaphragm muscle, which is actually your main breathing muscle. And we see this all the time in our clinic where there's like a whole host of imbalances. And then what ends up happening is the hip doesn't work well, and then you get compensations. And so for instance, in this case, that glute medius muscle may overcompensate and become spasmed. Now, what causes that? Now, if there is these imbalances around these muscles that are tight, they're spasmed, they're not working very well, what ends up happening is you actually will have changes in the alignment of things such as your pelvis. This is the pelvis, for example, there's your hip. If these muscles, which go through the hip, through the pelvis, up into the spine, if they are pulling and tugging on the joints that they are attached to, then it will pull and yank these bones out of alignment. And when they are out of alignment, they can then basically change the biomechanics and the way your hip functions. And so sometimes you'll typically see something like this. Now, this green check mark is kind of like the ideal alignment of what you should see when somebody lunges. You know, your knee should be in line kind of with the bottom part of the second toe. But oftentimes what you see, and you can't always readily see it because with dynamic sports, you're not like fully watching this. But in our clinic, we can sit there and actually dissect this down to really see, is this actually what's happening when you're playing your sport? Is the knee actually pushing out of alignment? And what does that cause? It causes strain along a lot of these muscles that attach, like I said, all the way up through the hip, through the pelvis, and even up into the low back. So sometimes, and oftentimes, people who end up having like a lot of hip issues may also end up having back issues, even though they don't actually have back pain, meaning the cause of it could be coming from the back. Now, for some people, it could also be coming from the foot. A foot alignment that isn't correct may also dictate what's happening up here at the knee, but that actually is being driven by the hip. The knee is kind of like the thing that goes along with problems that are arising here at the hip or rising down at the bottom. So if that is something that you are experiencing, then what do you do about this? And when we look at these hip muscles, what we ideally want to do is, rather than foam rolling and doing a lot of things along this ITB, which you're just kind of getting, right here, you actually want to go further up and start addressing things along the upper part of the glute and the pelvis. And you could do that with like balls, you could do that with foam rollers and things like that. And this might actually do the trick, and it may take care of a lot of your pain, and you'll be like, wow, that was amazing, what a miracle. However, for some of you, that might temporarily help, but it may not take care of everything. And this is where it's really important that all of these other muscles that we talked about are also addressed in terms of balancing everything out so that the pelvis is sitting in a better alignment. And once this is in a better alignment, then all of these other muscles, which actually are the steering wheels for how you do a lunge, starts to balance out, get into a better alignment. So if these guys are all tight, okay, or some of them are tight and they're pulling the pelvis out of alignment, which then affects the way you lunge, this is the heart of what we need to go to. Now, for some of you, and this is one of the reasons why we specialize in basically the hip, the pelvis, the lumbar spine, for some of you, there can even be deeper muscles that are involved. And those deeper muscles are muscles known as your pelvic floor. Now, these pelvic floor muscles are muscles that are inside of the pelvis. So if we look at the pelvis right over here, you can see all of these muscles that are inside of the pelvis. These are a group of 14 muscles known as your pelvic floor. Now, 2 of these pelvic floor muscles are actually hip muscles, meaning they come around and they actually attach to the hip joint. So if some of you, and you may not realize that this might be related to the hip pain that you're having in your sport, if some of you are actually having issues with things like your bladder, things like constipation or irritable bowel, or for, with sexual intercourse, you're kind of like, why am I having this weird testicular pain, scrotal pain in men, or for women, why am I having discomfort vaginally or with intercourse and things like that? These are actually screening questions that we actually ask our patients and our athletes because we want to make sure if the pelvic floor is involved, because two of the hip muscles actually come out and attach at the hip, that those muscles are not also playing a role in why the mechanics of your hip and the lunge is actually off. So just kind of throwing that out there, because we often see with patients that come to our clinic, they actually could end up being a problem. So this could be something that you might need to have addressed, but maybe has nothing to do with it all. However, if there is, then you really do want to also evaluate and treat those muscles of the pelvic floor. So if you live in and around this area, it's a no-brainer. If you've been dealing with this for a while, this video resonated with you and you're like, yep, this is me, then you can come see us. We have an office right in Center City, Philadelphia, but we also have an office right here on the main line in Narberth, Pennsylvania. And like I said, we've been doing this for 15 years, treating patients, and we have a tremendous amount of success because we look at this in a very holistic way and really get down to the nitty-gritty of things. Now, if you do not live in this area, but you're looking to get our help, there is an online consultation link down at the bottom in the description box, where you can sign up for a 60-minute consultation with us, and we can really dive into your history, find out what might be going on, and kind of create a plan of what is it that needs to be done. We even have online programs that can take you through a self-guided program at home, which the link will also be down at the bottom. We have one that is very specific for a male, and we have one that is very specific for a female. And even though it's called the Pelvic Pain Program, it addresses a lot of the imbalances that then lead to hip pain. So it's appropriate for anyone who is dealing with pelvic, hip, low back issues that you've tried to resolve and it hasn't. So that's also in there. And then you can piggyback a consultation at a discounted fee for that. Now, if this video resonated with you, like, subscribe, comment, and please share this video to those, especially if you're watching this video for somebody else. Share this video with them. We try to make videos every single week, and we definitely look at your comments down below in the box and respond so that we know what videos you guys want us to create. So I hope you guys have a wonderful day, and we'll see you soon in the next video.